Data in a healthcare context is all the information that is collected about a patient. Some of the data is very specific, described as structured data. So things like the prescriptions you receive, the results of your blood tests, and so on. But quite a lot of data is unstructured. It's letters written about you. It's information passed between physicians who are looking after you. Some of the data is visual data. If you have a scan, if you have a CAT scan, for example, the data. So the data is complex in healthcare, very complex. It's estimated that your health data is 50 times more valuable than your financial data, than your banking data. And the other point is, if you don't get it right, there can be serious consequences. So the importance of making sure the data is accurate, the data is secure, and the data is relevant is a challenge in healthcare. As part of the Connected Health Cities programme, AIMS are building what is being described as data arcs, which is a facility to be able to ingest the data, to be able to store the data. And we've done that for the entirety of the northwest coast. So we've taken data in right across the region. And it's what's described as hospital episode data. It's anonymized data, okay, so we don't know the individual patient identification, but it's data which tells us a lot about the healthcare operations for our whole region. So if you want to look at developing particular ways of segmenting this data or analysing the data, large data sets like that are incredibly valuable. So we've built an arc, basically an area to store that, connected to the NHS, but allows secure access for clinical researchers to be able to access that data. So the Northwest Arc was built about 18 months ago, and what we're able to do is to use that data to identify more accurately than is currently done particular cohorts of patients. So the clinical researchers have developed algorithms to properly identify a cohort. So take a condition like chronic obstructive pulmonary disease, COPD. COPD is a complex condition which has multi-stages. To be able to diagnose that the patient is suffering from COPD as opposed to, say, asthma, it takes a considerable amount of clinical judgment and measurement. By looking at the data, what we've been able to show is that not everybody who has this condition is properly diagnosed. And in particular, they're not necessarily on the right part of the pathway. The effect of this for patients is that if you are properly diagnosed, you are less likely to be admitted as an emergency case into hospital. So we can reduce the emergency admissions of COPD patients by looking more closely at how they are properly categorized and to make sure they're on the correct treatment pathway for their particular stage of the condition of that disease. The next stage in the development of the ARC, and we've built the ARC not only for the clinical researchers here in the Northwest, but also over in the Northeast, in Durham and in Newcastle, where they're looking at different clinical pathways. The next phase of developing the ARC is to bring in the tools, what we call big data technologies. These are the data technologies that were developed by Google back in the early 2000s that have enabled us to provide elastic search on the internet. These tools will enable a whole set of new approaches to caring for patients, and will also allow a much more individualized approach to patient care. So, for example, what we need to be able to do with COPD patients is if we can look at the development of the condition over time, we can predict more accurately the interventions that we need to make. So you can do things like predictive analytics. And the analogy in the rest of our life, of course, we can now predict. You can predict quite accurately when Uber will arrive the taxi will arrive on time. You can accurately predict things about the arrival of airplanes and trains and so on. We need to be able to have the same predictive capability when looking at our health data. And big data, and data lakes as they're called, will enable us to do that.